The back squat. With the bar positioned at approximately armpit height on the shoulder-high rack stand, move toward the bar and position the base of the neck or upper mid-back and the hips and feet directly under the bar. Place the bar on the back in one of the following positions. For a low bar placement, evenly place the bar on top of the posterior deltoids at the middle of the trapezius. Grasp the bar evenly with a closed and pronated grip wider than shoulder width apart. For a high bar placement, evenly place the bar above the posterior deltoids at the base of the neck. Grasp the bar evenly with a closed and pronated grip, slightly wider than shoulder width apart. For either bar placement, raise the elbows to create a shelf with the upper back and shoulder muscles for the bar to rest on. The remainder of this exercise will be shown using the high bar position. Signal the spotters for assistance and extend the hips and knees to lift the bar off the rack and then take a step backward. Position the feet between hip and shoulder width apart with the toes pointed slightly outward so the knees track directly over the feet. Stand with an erect torso by positioning the shoulders back, tilting the head slightly back, and protruding the chest up and out to create a neutral or slightly arched back. All repetitions begin from this position. Begin the exercise by flexing the hips and knees slowly and under control. Maintain a neutral or slightly arched back and high elbow position. Do not round the upper back or lean forward as the bar is lowered. Focus the eyes ahead and slightly above horizontal and tilt the head back slightly. Keep the body's weight over the middle and heel area of the feet. Do not allow the heels to rise off the floor during the descent. As the knees flex, keep them aligned over the feet. Continue the downward movement until one of these three events occurs. The thighs are parallel to the floor, the torso begins to round or flex forward, or the heels rise off the floor. Actual squat depth is dependent on lower body joint flexibility. Keep the body tight and in control. Do not bounce or relax the legs or torso at the bottom of the movement. Raise the bar under control by extending the hips and knees. Maintain a neutral or slightly arched back and high elbow position. As the bar is raised, resist the tendency to lean forward by keeping the head tilted slightly back and the chest up and out. Move the bar upward by pushing up through the whole foot with the body's weight evenly distributed between the heels and midfoot to keep the feet in contact with the floor and the hips under the bar. Do not allow the body's weight to shift forward onto the balls of the feet. Keep the knees aligned over the feet. Do not allow the knees to shift inward or outward as they extend. Continue raising the bar at an even rate until the hips and knees are fully extended to return to the starting position. At the completion of the set, signal the spotters for assistance to rack the bar, but keep a grip on the bar until both ends are secure and motionless on the supporting pins or ledge. This is the high bar back squat shown at normal speed. This video clip shows a common error in performing this exercise. The lifter flexes the trunk forward and allows the heels to rise off the floor during the downward movement phase. The lifter should maintain a neutral back and high elbow position and avoid rounding the upper back or leaning forward as the bar is lowered. The heels should remain in contact with the floor during the exercise.